Great. Well, welcome everybody to this second in the Research on Research Institute Culture Shift seminar series. We're delighted to have with us Ismael Rafols, now of CWTS in Leiden, and also of Spru at Sussex, and also Sara Nastrom from Vinnova, the Swedish innovation agency. Sara represents Vinnova in Sweden's national strategy for mental health, which is the topic of today's discussion. We're going to be talking about the alignment or misalignment between priorities and needs in the case of mental health research, as a sort of illustrative case of a bigger set of debates really about prioritization in research and in health research in particular. Which is a really important topic, something I myself have written and engaged with at various points over recent years, and one that Ismael has been very involved in pushing forward as a sort of field of study as well over the past 10 or 15 years. So it's really great to have both Ismael and Sara here. Some of you will have joined us for the first seminar in the series. We heard last month from Juan Pablo Pardaguera, who gave a fantastic talk previewing the headlines of his new book, The Quantified Scholar. And a recording of that, if you missed it, is now up on the Rory YouTube channel. Fran will put a link in the chat in a second. And we'll be putting this one up as well on the YouTube after today. So we decided to reverse. Normally, the format for these normally would be the main speaker, then a discussant or a response. But in this instance, we thought it would actually be good to hear first from Sara from Vinnova to set the context really for this kind of work and the project that Vinnova initiated with CWTS that gave rise to this. So Sara is going to speak first for 5 or 6 minutes, and then we'll hear Ismael give us an overview of the project and the findings of this work to date. We should also then have plenty of time for discussion, so do stay around for that, and also make good use of the chat function in Zoom to put comments and questions as we go along, and we'll pick up as many of those as we can towards the end. So with no further ado, I'm going to hand over first now to Sara Nastrom, as I say, from Vinnova, to set the scene and tell us a bit why Vinnova as an agency thought it was important to explore these kinds of questions in the way that this project has tried to do. Sara, over to you.
Thank you, James. Hi, everyone. First of all, thank you for inviting me to this seminar. My name is Sara Nastrom, and I'm working as a program manager at Vinnova. And as James explained, Vinnova is Sweden's innovation agency. And our mission is to enable innovation that makes a difference. Currently, I'm working at the Department of Health at Vinnova, and also the area called Sustainable Precision Health. And with precision health, our vision is that all people can achieve the best possible health and well-being based on their own circumstances. For the past 2 years, I'm also representing Vinnova in 2 different technical working groups. So firstly, there is an ongoing assignment that is about development of the new mental health strategy in Sweden, and in the area of mental health and suicide prevention. And this work is being coordinated by the Swedish Public Health Agency and also the National Board of Health and Welfare. This ongoing work is going to continue until 2023, and Vinnova is part of basically 27 different agencies working together very much interactively. And I would say this work is much more mission-oriented, and we meet a lot, have lunch-to-lunch meetings, and contributing to, when it comes to, for example, needs assessment, identifying different indicators for the strategy. At the same time, parallel to this, there is also ongoing work around Sweden's national research agenda on mental health and suicide prevention. And this research agenda is being coordinated by Forte. And I'm also sitting in that steering group for the 10-year national research program on mental health and suicide prevention. Just to give you a little bit of background why we thought it was important for us to do the mapping of mental health research that Leiden University has helped us with. As part of government's assignment with these 27 agencies, each agency had to submit individual analysis. So we submitted 4 different reports, and one of the reports that we wanted to highlight, it was
Sorry, you seem to have muted somehow.
Is it okay now?
Yeah, we just lost the last 25 seconds or so.
Just 25 seconds. Okay, yeah, I'm just going to just repeat then. Yeah. The purpose of collaboration with Leiden University was, I don't know if you heard about the 4 different reports that we have to submit to Department of Health as part of this work. So basically, Leiden University helped us to give an overview of what research and innovation in the field of mental health looks like, as well as to do analysis of what funding gaps there are. We also wanted to incorporate a perspective of different stakeholders representing a diverse range of disciplines and views. And the reason for that is because we wanted to give both to cover the broader area, for example, both mental health, mental illness, prevention, and well-being. We wanted to also highlight that today almost all the healthcare resources are being spent on diagnosis and treatment, and very little on promotion and well-being initiatives, supportive environments, and also prevention measures. So the work with the Leiden University, the result of the reports has made us to involve and gather views from different stakeholders, and also to involve, for example, the public sector, private sector, NGOs, including health sector and researchers. And I have to say that this shows that this type of study can also be used as an advocacy tool to initiate collaboration and co-creation, and also to involve actors from different sectors to join forces on strategic decision making. I'm just going to mention just one example that this collaboration initiated dialogue with the Swedish Research Council that is planning to put forward this 10-year national research program on mental health. And they have used a lot of the report's findings as basis for planning and also their program now forward. The work has also opened doors to have dialogue with different actors in Sweden and also across Europe, and put targeted areas and with mental health and promotion on the agenda. Lastly, I would also like to add that Vinnova is going to fund initiatives with the focus on innovation and health, and also in the area of mental health, but much more with focused on what we call sustainable precision health. We see here an opportunity that the new technologies which can create opportunities to access and use data and also to detect diseases earlier and prevent diseases earlier. We can also see that it's possible to tailor make more treatments and therapies based on more individual needs. We want to also see how interventions work and what doesn't work with this kind of, so this is our agenda now forward. Thank you. I will stop there. I think I will, Ismael, if you want to continue.
Thank you, Sarah, very much. And welcome to those who joined while Sarah was sort of in mid-flow. this, you're in the right place for the Rory seminar. We just heard first from Sarah Nastrom from Vinnova, who set the scene for the work that Ismael Rafols is now going to outline in more detail. So thank you, Sarah. That's really helpful. And we've put in the chat a few links to summaries, both of the project that Ismael will elaborate now in more detail, and also to some of the Vinnova documents and the Forte documents as well. So lots of further resources there to follow up on. So thank you, Sarah. We'll now turn, Ismael, to you for the feature presentation, as it were. You're going to give us an overview for about 35-40 minutes of this work, and then, as I say, we'll have some discussion. Do use the chat and make use of that as we go along.
Okay, well, thanks, James, for the invitation, and thanks, Sarah, for the introduction. Sarah introduced the rationale behind the specific case of mental health. In this presentation, I will try to frame it in the broader discussion on priority setting in research, which is something that might be of interest in the context of research and research institutes, where funding is, and priorities in funding, it's one of the key issues at stake. Let me begin by sharing who have been actually doing this work. So we have Alfredo Yegros has been the main bibliometrician. Wouter van der Klip has been the person who's run a lot of the qualitative interviews, focus groups, and Tim Willings has developed the visualizations. The outline will be starting from this broad motivation of thinking about research in terms of societal needs or demands, then focus specifically on what this means for mental health and well-being. And finally, I'll show the type of findings that we have found. And maybe I should start actually by saying that when we first received the request from Vinnova to do this type of mapping, trying to see, basically the question is, okay, we have this need to understand what type of research is carried out in the prevention, social determinants, rehabilitation side of mental health. And we said, actually, we do not know if we can deliver these with bibliometric tools. Because bibliometric tools are good at finding specific research topics or broad disciplines. The bibliometric tools that we have are not good in finding what types of publications are good for certain needs. Right? So rather than doing this as a consultancy, we propose to do this as a research project, and we will need a lot of your interaction. So we've run this as a project that was partly funded by Leiden University and partly funded by Vinnova. And I have to say also that the results were not, they shed some light, but were not fully successful in terms of identifying clearly what is prevention research. And so I'm saying this in the context of showing the results. You will see that there are still important gaps. Let's start with motivations. There is this perception that research is not fulfilling its role in terms of addressing societal needs. But this notion that research is not fulfilling its role is a notion that has come up in later years, since the social function of research has been changing. In the 60s until the 80s, it was assumed that all knowledge will eventually lead to some innovation, to some technology. Technology will lead to innovation, and innovation will lead to well-being. In the 90s and 2000s, the emphasis was, okay, yes, it is very important to create publications, but it's also important to have the researchers and research institutions have strong links with the users and beneficiaries of these organizations. This is the innovation system model, which is still the dominant framing in places like the OECD. But it has become increasingly visible that although having these linkages between research and innovation actors leads to innovation, the types of innovation that we achieve is not necessarily the type of innovation that is important for the challenges we face. Be it in climate change, be it in aging, or in our case, in mental health. And there is now a variety of new ways of thinking of innovation, like transformative innovation, inclusive innovation, that put the emphasis in thinking about what type of research, what is the direction of research, what type of research is carried out, so that the contribution of research is in the areas where there are gaps. And this is very closely related to discussions in the last 5-10 years in terms of mission-oriented research. So in terms of funding agencies, looking at impact has become important, but here the point is, okay, it's not just a question of having impact, but having impact in those areas where there are gaps in knowledge and where there are the most acute needs. And the question is thus, what type of research should be conducted? We have a need. In this case, the example is about energy, but should we do more research that is related to wind turbines, to biofuels, to nuclear plants, to solar panels? So which of the energy technologies are most relevant for certain context? And of course, the context, it's not the same if you are in Andalusia or in the windy west coast of the UK. And also given, and not just the type of energy technology, but also there might be other types of research regarding how the energy is distributed or about ways of reducing energy consumption, so reducing transport materials. There is a variety of potential research avenues that might be relevant to energy consumption. And it's not clear what is the appropriate balance between these research options. James Wilsden, in the biomedical bubble, written with Richard Jones, proposed that in the case of the UK particularly, there was a lot of emphasis on biomedical research, and much less research was going on in the delivery of the knowledge towards implementation in clinical settings or towards public health research in ways that were highlighted by the Marmot Review some 10 years before. So this is, in health, we have the same type of discussions. Now, it is often thought that the contribution of research is about providing solutions. But I am going to argue that when we are thinking about portfolios, it is important not to think necessarily in terms of the solutions that will come directly from the research, but much more about the capabilities. So it was shown, for example, in a study by Ben Martin, published in Research Policy in 2001, that one of the most important contribution of basic research to society was through the training. So when we're thinking about what type of research areas are being funded, it is about thinking of how people in doing research will gain certain skills that will be translated later in policy, in companies, in users, in NGOs, in civic, in social movements that are going to have an effect on broader innovations. Now, there is a high uncertainty about what type of technologies will be more relevant. So the other issue is that it is not worth that we should not be putting all the eggs in the same basket, because solutions or benefits from research might come from unexpected avenues. For example, in the case of malaria, it is now accepted that after decades doing research on drugs and vaccines, so far the most reduction in malaria burden has come from insecticides nets, which is a really low tech. And the other issue is that in different social contexts, there are different values. And this means that different type of solutions and therefore different research agendas might be favored. Let's take the case of obesity. Some people would prefer having a bariatric surgery than doing physical exercise. Others would rather go for a drug, or others for a diet. And these might depend as well on the values of a given society. So when we're thinking of this portfolio approach or way of thinking, it is important to keep in mind that the distribution of research across different research agendas is telling us about capabilities, that there is a huge uncertainty, and that there are values attached to it. Now, if there are values, it means that funding agencies are not in a position to decide what is the best response and roll it, but rather are in a better position if they go through what Ludwig and others have called a negotiation strategy in the face of wicked problems and the type of health problems we are dealing in cardiometabolic or mental health or aging are these wicked problems. It is important to consider this portfolio of approaches, and this involves participation, which is why rather than going for a purely methodologically quantitative method, we have carried out this project as a mixed method, with one part that was qualitative, interviewing and doing focus group, and the other quantitative, about looking at what type of research is carried out. So in the phase of the question, so is research actually aligned with the stated priorities? What we propose, very simply following actually ideas that came from Daniel Sarevitz and Roger Pilker, is to compare the perceived needs, demands with the research investment and outputs. In this particular study, we will focus on the publications, but there's a possibility of looking at research investments. And this is something where we hope that the Research on Research Institute, with the funders' data, will be able also to actually make analysis of. How do we frame mental health? Well, this slide is repeating a little bit with Sarah was explaining before. Vinnova's interest in the phase of this national strategy on mental health are about sustainable precision health, in which, although Vinnova in principle might be interested in the whole portfolio of mental health research, there is a very high interest in looking at the environmental and social factors and moving beyond medicine and biology, also in terms of innovations. So the issue of artificial intelligence was something that was discussed, although in the end we didn't manage to find the time to look at it. And with this explicit interest in prevention, rehabilitation, social determinants. But this is something that bibliometrically is complicated. Now, this focus of Vinnova on these broader issues, prevention, social determinants, comes in a context in which WHO definition of health is also shifting. So already for a number of years, it has been stated that health is not merely the absence of this disease, but we are interested in well-being. And therefore, mental health is not only about mental disorders. So what we are trying to do is, on the one hand, we are going to ask people what are the needs in mental health, and on the other hand, we are going to try to map what research is carried out in mental health. But to look at what research is carried out in mental health, we have to take into account that there is this broader understanding of mental health, which is not just about disorders, it is also about well-being. So it's about psychosocial interventions, rehabilitation, health determinants, health systems, but also the conditions that might be leading to problems such as job conditions that are stressful, poverty conditions, situations which are highly stressful, such as refugees, migration. The way we developed this is we had, prior to this report, bi-weekly meetings with Vinnova, and this helped really Sarah's contribution in pushing us really in being broad. Then doing these qualitative and quantitative approaches of interviewing people and doing the bibliometrics in parallel with a bit of ad hoc juggling. We did the 3 focus groups and the bibliometric mapping. And to be honest, for all these efforts and doing the quantitative and the qualitative, we are making progress, but still there is a huge gap in terms of how to go from the insights that you get from the comments and the questions and the insights that you get from the mapping. And so we have had to do quite a bit of interpretative work on the bibliometric maps because they do not speak in the language that the stakeholders speak. The mapping methodology. Again, there are a number of choices that have an influence in the results. We chose to use the Web of Science because it's the one we currently use by default, but we have to acknowledge that it has a bias towards biomedicine and towards English. It's problematic in this respect. We used the medical subject headings of the National Library of Medicine. Again, this is biased towards medicine, but on the other hand, using this very well-established classification gave us the robust base to have discussions with sort of more, let's say, conservative people who might have challenged the analysis. And a huge issue is how you classify mental health in terms of topics. And we chose to do 2, in a way, complementary approaches. On the one hand, to use large disciplines. These are the Web of Science categories. These are disciplines such as social psychology, clinical psychology, then neurology, biochemistry, and so on. And also in parallel to use what I call the article level categories, which are very specific clusters of publications that reflect, we hope, the scientific dynamics. It's a bit like broad scientific communities as shown by their citation patterns. And all these choices are problematic. So I think when we're making these maps, we have to acknowledge that what we are getting is one of the many potential perspectives of the type of research that it's being carried out related to mental health, and that there are equally legitimate other mappings. Very briefly, what were the main insights from the qualitative study? The first is that there is a gap between research and practice. This is what is often termed translational gap in medicine. But when we talk about mental health, since we go beyond medicine, the gap, I believe it is bigger. So people working on mental health in clinical settings might be a bit detached from research in biomedicine, but we found that people working on educational issues, labor issues, or let's say migration issues, are far away from mental health studies than those in medicines. And the connection is hard to make. So there is really this need to bring mental health research towards beneficiaries in areas or sectors such as education, labor, and migration or social work that are far from the research. The second is that there is a changing understanding of mental health in the sense that there is an increasing awareness of mental health problems, that these are not just the very clinical mental disorders like schizophrenia or bipolar, but that depression or issues about problems in education are becoming more included in what is understood as mental health. And this happens in a context that there is more demand of acting before there is mental discomfort at the subclinical level. And therefore, this is linked with the demand on the Vinnova side of more emphasis in prevention rehabilitation. And to transfer the research to these non-clinical settings, such as schools, family, or jobs. And the third sort of main line of insight in the qualitative side was that if we are moving to these broader sectors, to these other sectors, then to these non-clinical environments, and transdisciplinary approaches between mental health, so between whatever psychiatrists, but psychologists, but also people who are experts in social work, education, labor, is necessary. And this is particularly the case if we are thinking of mental health in the full-blown understanding of well-being. Good. So let's move to the mapping, to the more concrete results. And I'll start with this disciplinary approach. And here I should say that all what I'm going to present now is available online in the interactive web page that James put before. So James, if you can put it again, this is the interactive web page will allow you to play and get the type of maps that I'm showing. So the first entrance just allows to see the number of publications by country, but in terms of the units in which we describe the work, we have countries. In some cases, we did also the regions. Then funding organizations according to acknowledgements. And here we have to recognize that in some cases, and some funders, I think in the case, which is the case of the UK funders, for example, we believe that funding acknowledgements do cover a substantive part of what has actually been funded, but maybe in other countries, that might not be the case. And so the first piece of information is the number of publications. And we see these 60,000 publications per year, which represent about 10% of what might be considered health research, 3% of the total web of science. And then, well, this allows sort of getting a first idea of what is the size of the organization, what is the volume of publication of the organization you're looking at. The second page in the interactive website, we aim to provide a description and disciplines. And here we created these big 8 disciplines with Web of Science categories, from social sciences to more to the very micro biomedical research. And in these large terms, there is this discussion, but to which extent there is a lot of neuro. Okay, I assume you can see the pointer. Yeah, good. You can see that there is a lot of research in neurosciences, quite a lot of research in medical specialties. This was a bit of a surprise, but we believe this is related to comorbidity, meaning mental health is associated with many diseases. People suffering from cancer or even dialysis might suffer a number of problems. Then maybe in relation to Vinnova's demand, an important issue is to see that social sciences, public health and healthcare are relatively small. Only 18% of the total amount of publications, but they have been growing from representing 11% of the publications to 18% in 2009. And we use this description in order to compare countries. And here it is interesting to see that countries do have significantly different profiles. So we see that Germany has this focus in neurosciences and psychiatry, that the EU in average still has this a high focus in the neurosciences, that the UK has a more balanced portfolio towards the social sciences, public health, and then not surprisingly to many, the Sweden, Norway, Finland were the countries which had the biggest share of publications in public health, healthcare, and rehabilitation. We can compare also research councils, and here it was striking to see that the European Research Council had this focus, narrow focus in the neurosciences, with very little mental health research on the public health and social sciences. And then again, countries and this is a general research council, not focused in health. So countries like Norway, so Nordic countries again with a focus in public health. But when comparing these different research councils, it is always important to be aware that a research council is part of a broader set. So for example, the Swedish Research Council has less research in public health and healthcare than the Norway Research Council, because in Sweden, there is a specific health research council that is going to cover part of it. Good. Then even when we focus in health research councils, we see that some of them, such as the French or even the UK, have relatively little research on healthcare and public health, which are the type of areas in which there is a perceived demand. Good. And there are a variety of analyses. So this was the analysis at high disciplinary level, which we could say actually that there is no surprise that this focus in the neurosciences in many countries with the relative exception of Nordic countries, but even there, public health and was not the biggest part. But then we were concerned, two things. First, that this analysis was inaccurate because we're dealing with really large categories. And second, Vinnova is interested in specific targeting of funding. And this is something that Sarah mentioned. So what we did is we took this research method that came from Lodo Waldman and later developed together with Edna Jones at CWTS, which takes the full Web of Science and splits it into 4,000 specific clusters that are on narrower topics. And from these, we took the 280 categories or topics that were most related to mental health. And then we placed the topics according to their similarity. And the type of map that you get is one end is related to biomedicine and neurology. And then you have these vertex of a triangle, which is in neurosciences. Here in the top end, you have issues about neuroimaging between neurology and experimental psychology. Then you have another vertex of the triangle, which is in psychology, from experimental psychology in the top to social psychology in the bottom and education. And then psychiatry in the middle with these last vertex at the bottom being between public health and clinical research from left to right. And then the topics are presented with the size of the bubble representing the number of publications in a given topic, so in mental health, and the color is telling us whether a topic has most of the publications in that topic as related to mental health or not. And this was important because this allowed us to pick up, really small topics, like, for example, this one at the bottom left is related to HIV stigma, which is associated with depression. So it was a way of identifying specific issues that were not necessarily narrowly about mental health, but that were related to mental health. Or here in the biomedicine as well, research on protein folding, which is related to Alzheimer's problems of protein folding, right? Or on the top, issues related to bioimaging that are being used in mental health. And then, so here, what you can see is that in the third map that you see in the interactive website, you can overlay specific disciplines. So we see, okay, neurosciences is occurring in this area of the map. Health policy and services is in the bottom left. So you can play and find out how the different disciplines are located in different parts of the map. We also analyze what are the position in the map of mentions in policy documents or patents, and this is telling us about also the type of usage, right? So we see that policy documents, that citations in mental health, that publications in mental health are mentioned in policy mainly in the public health area, whereas publications in mental health are related to patents mainly in the biomedicine area, and you can actually go and see the specific areas. And then we can also look at the specific diseases. So we can look at here Alzheimer and other dimensions and see that there is a cluster related to family caregiving, another related to the psychiatry, dementia, and another related to the biochemistry of dementia, the protein folding. But in some other cases, like eating disorders is just one cluster. And this is a problem in the sense that it's not easy to distinguish between what's prevention and what is treatment. We can do then an overlay, meaning project the publications of a given country in this map, as we do here for the case of Israel. And you see the case of Israel is illustrative in the sense that you see that the biggest clusters in post-traumatic stress disorder, which is associated with military defense in the US, also is funding mainly this cluster. And here, when looking at countries or funding agencies, what you have is that the darker colors now mean that the countries are specialized in a given area. What do we find? We have a break. What do we find when we look at funding organizations or countries? We can, at this cluster level, we are able to find the specific issues in which a country is specialized. So in the case of Sweden, we see Alzheimer, issues about public health, like community treatment, social determinants such as refugees, income inequality, job insecurity. Whereas if we look at the UK, we find some common issues such as community treatment, but some other issues such as schizophrenia, autism, or sexual offenses. So you can look at the specific areas of focus of countries. And there is this fourth window in the map, in the interactive website, which allows you to compare two countries. So here we can compare the European Research Council funded areas, which in accordance with what we had found in terms of disciplinary description are in the areas related to neuroscience, imaging, as well as biochemistry and neurology, but very little in the public health or the clinical research. Whereas the Research Council of Norway has much more research on public health and psychology. And they are both councils that fund, in principle, all type of research. So we see that there is clearly a difference. Then when we compare health funding agencies, we can see also a striking difference between Forte, which is the health funding agency of Sweden, with a very strong emphasis in public health, social determinants, with some research also on treatments in Alzheimer and issues like autism or ADHD. Whereas if you take Spain, where we know that a lot of research is carried out in hospitals or university hospitals, or joint university hospital institutes, you see most of the research is focused in the biomedicine and the clinical area. So we think that the tool allows to see what are the different focus of different funding agencies in comparison. And so in conclusion, whereas a lot of current research in mental health is focused in psychiatry, medical research, and neuroscience, with relative effort in public health, social sciences, and healthcare systems, this is in contrast with what was the perceived needs by experts, which focused on the importance of putting more emphasis in more systemic research, healthcare systems, social and environmental factors, and more transdisciplinary research. Now, this focus on psychiatry, medical research, and neurosciences differs quite a lot between countries. We see that Nordic countries are actually putting much more on the public health and healthcare systems, whereas some funders like the European Research Council welcome, I didn't show it, but it's also had been so far very heavily focused on the more brain imaging side. Whereas other funders like INSERM or the Research Council for Health of Spain are more focused on the biomedical focus. So the idea is that this type of approach, in which on the one hand, we ask experts what type of research they think it's needed or most important, and on the other hand, we do the mapping of what type of publication outputs you have, allows to see potential misalignments, or well, basically allows to question current priorities. Although we did this mapping for Vinnova, the international comparison was a strong interest of Vinnova. And given that we mapped internationally, we have had events in Catalonia, in Norway, and in Lisbon, and in which people from either from the research councils and ministers come. We believe that this is a type of approach that could be brought to other areas. And we're planning a workshop in Brussels late in the year. We also hope to be working along these lines in Rory. So if you are interested do not hesitate to contact me. And thank you for the attention. And that's it.
Great. Thank you, Ismael, very much. Sorry, my connection was dropping a bit there. But no, that was brilliant. Thank you. Really fascinating, rich presentation. And I really hope too that we can pursue some of these kinds of questions through Rory's work over the next phase as well. Is my video working? I can't see myself for some reason.
Your video is off at the moment.
Oh yeah, I'll turn it. Zoom is glitching a bit here. Sorry. Yes. Hopefully it'll come back. You can hear me though anyway. So apologies. For some reason it's stopped working. I don't know. Never mind. We'll ignore that. Hopefully it'll come back in a second. But thank you very much. Really, really interesting. Let's turn to questions. And who would like to fire away with a thought? Please, use the usual hands up function in Zoom to indicate, or obviously you can put questions as well in the chat. Let me just start with one as well. Inevitably, one wants to ask how much the sort of COVID context has changed the picture, either in a short-term sense or in a longer-term sense, in terms of shifting some of the balance. And I just wondered if that was something that you'd observed yet in your analysis, or if it was sort of still too much of a recent phenomenon. You might have seen the piece that Daniel Hook and I did, where we, broadly defined COVID research as a category in 2020 accounted for 4.5% of all research outputs, and then by 2021 had risen to nearly 9% of all research outputs. And obviously within that there is a shifting of priorities as well, in terms of the implications of that for health research. I just wondered, Ismael, if that was something that you'd observed.
Sarah, do you have views on this in terms of? So I think that I understand the question in two ways, James. On the one hand, on the demand side, is there more awareness of the importance of mental health? Is there a broad understanding of mental health? And second, in terms of the outputs. So maybe, Sarah, to you, maybe you can start with the perceptions.
I definitely think that there has been shift, and in some ways, I think we have put mental health on agenda as well. Issues like, for example, loneliness and alcohol abuse, as well as different more bigger issues. I think it has been more shift in terms of COVID. And I can also see, particularly in Sweden, I can see that there are a lot of more needs assessments around this, and also a lot of debates and discussion.
Yeah. And so our perception has been that, I was talking about this broadening of what is understood as mental health. And I think that so the impression is that COVID has had an effect on these, for example, in teenagers, right? And then on the output side, in the data that we have in the interactive webpage runs only until 2018. But for newer data, in 2020 shows that there is actually a cluster related to mental health and COVID. So one of the 4,000, so it's a spike. But yeah, we haven't, to be honest, we just found that. We haven't put more attention on what it means.
I can just add, for example, for our individual analysis that we have submitted for this new strategy in Sweden, we did a couple of, we funded research actually, we focus on ICBT, but also highlighting the need of these kind of online services, like, for example, Mindler, and we have these kind of ICBT services for older individuals 18 plus, but there is also need for younger teenagers to be able to access this. So there has been attention to this kind of research as well.
Great, thank you very much. Apologies again that my video, I can't seem to find a way to go back on. It might be because I'm recording the session, so apologies for now for the disembodied voice you've got sharing things. But let's turn to Rob Smith for a question. Rob.
Hi, Ismael. Thanks. Yeah, it's really thought-provoking as ever. So I've got two questions, and they're not fully formed, but hopefully they will emerge. The first one is about, so you talked about, I mean, I guess outcomes, and there are always multiple solutions to the same problem. Bed nets versus vaccines being the obvious one, right? But there are also different ways of approaching that problem, right? So malaria could be understood as a problem which is amenable to technological solutions, but it could also be understood as a problem which is a social, problem, or a problem of poverty as much as anything else. And so I'm wondering whether there are ways of getting at those kind of framings in a portfolio analysis. And also kind of similarly, we know that if we're thinking about outcomes, actually the thing that drives outcomes as much as anything else is about the organization of research. So is this kind of working on a kind of bench to bedside model, or is this something which is a kind of bedside to bench model, which is driven by patient organization? So are there ways of getting those kind of questions in the mapping and bibliometric work you're doing? And then related.
So the second one, so the translational issue, I didn't get it.
So that's the first question, is like, are there ways of getting at these kind of structural things that we know are important to shaping outcomes from the mapping work? So we know from qualitative work that that's the case, but like, can you begin to get at that at a portfolio level? The second question is, how is this received? So we also know that research agendas are very fragile. They're very politically sensitive in lots of ways. They have to be negotiated very carefully. So I work with a consortium of European research funders on health and on biotechnology. These are very complicated things to negotiate. So what's been uptake on the other side on funding agencies? Like, are they willing to kind of engage in this negotiation process and kind of go through this? It would be interesting to hear how this goes down, because I know it's complicated.
Ismael, over to you.
Thanks. So let me see, I'll share the screen to try to answer the first one. As I mentioned before, and I didn't do it during the presentation, is the perception is that we failed to make a mapping that could cater to Vinnova's interest in finding, prevention. These are the topics in prevention. These are the topics that are related to rehabilitation. And these are the topics. We failed to do this, right? We only managed to provide a picture in disciplinary terms and a picture in topic terms. So in disciplinary terms, right here, well, the idea is that we do not know how this relates to the structural issues, but chances are that social science, public health are discussing the more social structural issues, whereas biomedical and psychiatry are providing the more technical solutions. So, we failed, but the information can be interpreted in hopefully useful ways. If we move to this research landscape, it's more so, because so here, for example, you have a cluster in autism. Can you see it, the image well? Yeah, right. Here you have one cluster which is an HIV transmission and counseling. right? Here you have human trafficking. So I think that the bibliometric contribution of this work, which builds on the work in CWTS, is that on the one hand, these clusters are a bit arbitrary because they come from the arbitrary from the point of view of they are not the framings of the problems as people in funding councils at high level, or people when thinking about how are we going to address mental health in Department of Health. They are not using these are the scientific clusters, but because you see this one in food insecurity is telling us that 18% of papers in this cluster are related to depression and stress. So we are highlighting, and I do not know of other studies having done this before, that a variety, homelessness, and you see homelessness, we are at 50% of publications of this cluster related to mental health. Bullying at 70%. So we are highlighting that, issues around internet addiction, many social issues that would not have been mapped in the conventional mental health study, you can see them here. But again, we don't have a tag here that says this is about rehabilitation, this is about prevention. You have to go one by one and interpret. So in this sense, the bibliometric is failing because it's not coming up with the classification that is used in health policy.
But maybe it surfaces these things that you wouldn't otherwise be discussing. So in that sense, it's useful. Yeah.
Sarah, I don't know if you want to add on this, on the uptake.
I'm just thinking, if I understood it right, it's more like patient related when you are involving more patients into the research. And I'm thinking like there might be changes coming, and we in Sweden particularly, we are looking at it. So then it would be possible to maybe map it as well as part of this. But I don't know if there is any articles around it, but I know that there is a lot of work where patients are being involved in research as well.
And the second question, Rob, about the uptake. So I remember a few years ago, I met the director of a biotechnology park close to university. And he said, and I was showing him this idea of the portfolios with experiments I've been, and he said, with this you go nowhere, because if there is a policymaker which is going to change the distribution, his head will be gone in 6 months, right? Because redistributing means that somebody is going to lose. But so this is the first study that it's really policy driven, like that we've done together with Vinnova. And the surprise is, so in the case of Vinnova, there is a clear demand. It's part of a large exercise with 27 agencies and the Health Research Council involved, and we had an interaction with them, and they use it in ways that we do not know, but they to set up their plan. But where I've seen the changes is when we presented these in Catalonia and in Portugal, the maps, the comparisons between countries and funders helped. Well, basically, we are giving in Catalonia, there is also a national plan for mental health being at the first year. So being able to show that Catalonia is very focused on the clinical and biomedical, because there are powerful and excellent hospitals here, whereas Sweden had so much more research on public health. This is something that has helped move the discussion in terms of priorities in mental health. And in Portugal, it was interesting because it was the map is different. We have here, I don't know if Susanna is still there. So in Portugal, what happens is very different from Catalonia. Is hospitals are not very engaged in research there. So what you could see in the case of Portugal is that there is a lot of research in the biomedicine, psychology, but not in the applied areas of public health or clinical psychiatry. So the director of the mental health plan in Portugal thought that this was useful information for him to push towards more applied research on both ends. So in a way, it seems that it's useful as a tool for claiming, to make your case. So when people see their positions reflected, and it supports positions, it seems it's useful at least to get the debate. I don't know, what are your views? You also have had experience.
Rob, do you want to respond? Yeah.
I think that's the goal, right? Is it has to be about creating debate within agencies that want to have that debate. The difficulty I've seen when we've tried to do this is that, my experiences with ERANETs, right? And so the ERANET schemes are 20 different national funders coming together, and they have completely different ideas of how you should even go about funding research. And so the main sticking point is not so much about priorities and whether you have a debate. The debate is about whether or not you should even be prioritizing, and I think the other challenge is about aligning perhaps research, the amount of time it takes to do this with the agenda setting process. So an ERANET, would have a timeline or a process, but this would be happening on quite a rapid timeline. And that's been the other difficulty in doing that. So they're happy to have negotiations in principle, but in practice it becomes quite difficult. So I think it's refreshing, I think, to hear maybe the individual agencies are different because you have more leeway and more freedom. But they're all interested in it. I think that's the other thing. So I've suggested this to them, and they're kind of like, oh, this is really interesting, we'd like to do it. But thinking about how you get it to fit with a timeline where they're developing calls and things like that seems quite tricky.
Ismael, did you want to respond again to Rob on that?
And one thing that we have not done yet, but I think, so not from the inside, but from the outside, is to be making some organizations uncomfortable. So for example, I really want to understand why the heck the European Research Council is funding only brain research, and it's not interested in biomedicine or public health or social aspects of mental health.
Have you asked the ERC that, Ismael?
No,
right.
No, I haven't. But it's interesting to see, it's Oxford and Cambridge are in similar places, right? So it seems that a certain way of understanding excellence is really topic it's focused on certain topics. And I think, James, this goes around you. It's also the issue of concentration that was debated in the biomedical.
Yeah, bubble, yeah.
The biomedical bubble, right? Whether there is so a certain concentration in topics and around excellence is associated with understandings which are related to specific places.
Yeah, it's really, sorry, again, my video is not working, but I mean, it is really, I thought that, I mean, the data you presented there was really fascinating in terms, and also the differences from different systems. I wonder, I mean, not to try and explain the ERC's mysterious workings without inviting them to do so, but I wonder whether it's all, do you think it's also a reflection of the fact that some of the more sort of real world problem oriented research will be taking place under other aspects of the framework programs, and so that creates a sort of dynamic where the ERC is funding work that somehow, you know, is almost deliberately further removed from, you know, real world health applications and more upstream in those kind of neuro type domains. I don't know, but it is very odd. It's a very odd you know, split of resource. It doesn't make much, you know, it's not intuitive. It would be great to hear a justification from the funders of why.
No, it's and so the international comparison might also be interesting. Even countries like Sweden and Denmark have quite different profiles when you do it at the small topic level. And there, our hypothesis is that in the case of Denmark, you have pharmaceutical companies which are supporting or which might be driving the system towards schizophrenia, bipolar type of research, which, whereas in the case of Sweden, the big pharmaceutical company AstraZeneca is not active in mental health, and therefore it's not driving the agenda. Right?
Yeah, no, that's certainly, you know, a potential explanation. Sarah, can I just come back to you? I mean, Ismael made the point there about, you know, in a way, this kind of work needs to make funders and policymakers feel a bit uncomfortable because it's shining a light on aspects of decision-making and prioritization that are often obscured from view and may often not be particularly explicit in the way that they've actually played out. You know, that they've arisen through a combination of factors which, you know, aren't always deliberate. I just wondered how, I mean, whether this kind of stuff had made you, not you personally so much, but sort of Vinnova as an agency uncomfortable in any ways, or had sort of raised difficult questions, or whether you sort of felt, you know, I guess how you think funders can kind of navigate that rather difficult line between sort of encouraging this kind of critical probing of upstream prioritization and its alignment with needs, and you know, the obvious organizational and indeed wider societal pressures sometimes not to draw attention to these sorts of things.
I'm just thinking for us in Sweden, it's a bit different with, for example, we have Forte, the Research Council for social welfare, and they have received a lot of money from the government with focus on mental health research. So they are focusing on that, and we are more supporting their work. The same thing with the Public Health Agency. They are also funding different kind of work, and it can be different kind of reports and things like that. When it comes to, for us, we are focusing very much on life science research and on the biomedical side of it as well. But at the same time, working with this new strategy around mental health has made us also to realize that we have to incorporate this more in our different calls. So I'm just thinking there is this thing as well, when you have to, when you receive funding, then you have to put together a call. You have to really take a step back and involve different kind of disciplines, even in your organization, because it's about getting different perspectives before putting out a call. And also when it comes to making decision on which projects are going to get funding, even there you need to actually involve different experts. So not bringing the same people who are going to give their opinions on different projects and what you should fund or not. So I think it's about the process, how you are going to basically process of decision making needs to be overviewed.
Great.
I hope I answered your question.
No, that's very helpful. Thanks, Sarah, very much. Just finally then, before we wrap up, Ismael, I mean, you touched a bit on sort of future directions for this work, and you mentioned obviously the hope that some of that might be pursued through the work we're doing, you know, with you and others in Rory. I just wondered if you could just sort of end with a quick pitch for what you'd like to do next in taking forward some of this kind of analysis.
Sorry, my mic was muted. So you see, what we have done here is doing the mapping with publications, right? So one very important thing which is missing is what is the portfolio in terms of funding. And the funders database that will be set up as part of Rory would be a fantastic opportunity to see, just to compare funding and publications. And we know that they are both different and complementary, right? Because in the health area, you have research that is carried out at universities by lecturers who don't get funding, and at hospitals by practitioners who don't get funding. So the number of publications in some areas might be high, even if they don't get much funding. So being able to compare the funding, as well as being able to compare what is submitted to funders and whether there are potential biases in the topics in the selection process. So whether funders have certain preferences. I think these would be two very important developments within this research agenda.
Great, thank you very much. Yeah, no, and I say I'm really personally enthusiastic that we carry and do some of this sort of work. Great, Grace has just put a useful comment in the chat as well about the sort of turn to neuroscience in research. Thanks, Grace, very much for that. Great. Well, with that, we're going to draw to a close. Again, apologies that my video, this doesn't have happened to me before on Zoom in all these years of Zoom meetings that we've been through, but I've been loath to turn myself off because I'm recording the meeting. So if I restart, I might crash the whole thing. Fran is just putting into the chat some details, and I've also put some links for the next seminars in this series. We're trying to hold these Rory seminars on the third Thursday of each month. We will take a break for August, given many of us in Europe at least are on holiday or trying to have holiday. But we will restart on the 15th of September. We've got Cameron Naylan from Curtin University in Australia, who's going to be talking about some really great work they've been doing on linguistic language diversity and also some other new stuff that he's been cooking up that we'll add to the event abstract shortly. We've then got a really interesting session coming up on the 20th of October on decolonizing the global governance of research, and Joy Zhang and Saheli Datta-Burton are going to be talking about some of the ideas in their really interesting recent book, The Elephant and the Dragon in Contemporary Life Sciences. And we've got a response from Katja Lasch of the German Academic Exchange Service. And then in November, it's not yet up on the site, but will be soon, we have Kristen Smith, who is the founder and member of the Site Black Women Collective, which was set up in the US and has been pushing for more citational justice in various important respects. So those are just a few of the seminars coming up. We have a mailing list, a Rory mailing list. You can sign up on our website and then you'll get the monthly newsletter with all of this and more. But with that, let me just end again by thanking very warmly both Sarah Nastrom from Vinnova and Ismael Rafols for a really interesting session. And we look forward to seeing you at the next one. Thanks again.
Thank you.